So I'm just going to give a very brief overview of some work that Patricia, Valerie and myself and others have conducted in Queensland around supportive care needs. And I thought we'd have a look at that data and that study where we collected that information and compare breast cancer patients in that study with other cancers and see if there are any differences in supportive care needs. So I'm not going to worry about this. So it's well documented that in general, Aboriginal and Torres Strait Islander people face additional barriers when accessing the health service, whether it be cancer or other areas. And I've listed these here in these three, in a pictorial graph showing the sociocultural, patient and healthcare system issues. And given all of the discussion that we've had this morning and around the poor cancer prognosis and the unique barriers that Aboriginal and Torres Strait Islander face, it's highly likely that our patients are going to have a higher unmet supportive care needs. So when I'm talking about supportive care, what am I actually talking about? Well, supportive care aims to prevent, reduce and alleviate the symptoms of treatment and enhance communication between patients and clinicians and assist patients and their family to manage the needs associated with their diagnosis and the treatment of cancer. So a person by the name of Fitch, actually from Victoria, developed this model around supportive care. So all cancer patients require some level of support around what is cancer or what is their treatment and what steps do they have to. And that's at the top of this picture here. But you can see as we progress down, there's many patients who require more support and further referral. There are some patients who require early intervention and more tailored strategies to address their needs. And there are fewer patients with complex needs that require specialised services and support, particularly around addressing their supportive care needs and other psychosocial sort of issues. And this green area is where I believe the majority of Aboriginal and Torres Strait Islander people with cancer fit. So unmet needs assessment, it's different from other tools in quality of life and other areas in psycho-oncology in that assessment of needs, it's from the patient's perspective. And so it's the patient's perspective about what are their concerns and if they have concerns for need for help with transport, how much help do they actually need for that transport? They may not need any. It is a concern, but they don't need your help. They're all sorted. But in some cases, they may need a lot of help. So it measures the gap between what they're experiencing, what their expectations are. So our team in Queensland developed a unique tool to assess the supportive care needs of Indigenous people with cancer. There were other tools that were used in the cancer arena for all cancer patients, but when we reviewed those, they weren't culturally appropriate or applicable for Aboriginal and Torres Strait Islander people. So we designed this specifically developed tool, 27 items and 4 content sort of areas. It's verbally administered, unlike other tools which are usually given to a patient in a waiting room. So this Queensland study that we conducted was 248 Indigenous adults with cancer were recruited, male and female, all cancers, all adults. And of that group, 60 of those were breast cancer patients and all others equal to 188. When we compared the background of the breast cancer patients to the rest of the group, our Indigenous breast cancer patients were more likely to have secondary and post-secondary school education. They're more likely to be outpatients at the time that we recruited them. They're more likely to have surgery and adjunct therapy. They're more likely to have local and regional staging, more likely to be employed, and they were also more likely to have more contacts with other Aboriginal people, other Aboriginal families and members. So of those patients in this particular study, again comparing the breast cancer to all other cancers here, for those who reported at least one need for help, breast cancer patients, we had 68% of them reporting, whereas 71% of all other cancer patients. When we looked at comparing the needs for all of the items between breast cancer patients and non-breast cancer cases, breast cancer patients were significantly less likely to report a need for help with the concerns about the worries of the family close to you. Okay, so they're less likely to report. This was the only significant item. This is very preliminary sort of analysis that I just sort of put together for today. However, when we look at breast cancer patients in comparison to the others, we know, whilst not significant, they're more likely to need help with physical pain, feeling unwell, help around the home, and feeling anxious. But our breast cancer patients are more positive in their spirit. They have less concerns about the worries of those close to them. When we looked at, because in this study we also included some tools to assess distress using the distress thermometer, and so again, whilst not significant, 62% of breast cancer patients experienced distress, while there was 57% for all other cancers. And for worry, we're using the cancer worry chart, which hasn't been widely used in Australia but has been overseas. 48% of breast cancer patients experience worry, while 50% for the rest of the group. So just to finish up in this very short snapshot of supportive care needs, there are obviously limitations. This is very preliminary findings. There are limitations because when I did the analysis, I compared all the breast cancer cases, which were all female, by the way, to the rest of the group. It was male, female, so obviously I've got some work to do, but it was just to give a snapshot. So need to do further analysis. Maybe the higher distress, anxiety, pain, feeling unwell are related to the fact that in this particular study, 76% of breast cancer patients undergo a combination of surgery and also adjunct therapy. And so that could be related to pain and concern about having the surgery. But I guess what's interesting is why are Indigenous breast cancer patients more positive in their spirit and have less concerns and worries about those close to them? And I guess we need to do more further investigations in regard to this and with a larger study size. So that's pretty much it, a snapshot from me about supportive care needs. But what I think now is most important, we're moving on to a duo session. We're trying to think of the WA duo team. We're giving them a name because they've done a couple of talks together. And so we're going to put two chairs here. And we're actually going to talk about, I guess from a clinician's perspective and an Aboriginal cancer survivor's perspective, how they interact and how they supported each other and how they mapped that journey. So, sorry, Kate, I've taken over here. So, Roshi, if we could ask you and Annette to please come forward. Thanks.